A closer look at the safety of painkillers over the counter during pregnancy after new research linked Tylenol to ADHD.
Acetaminophen, the active ingredient in Tylenol, frankly, and several other drugs as well. The interesting thing is it's long been thought, even dads know this, that it's one of the few safe things you can take during pregnancy. Nina Criscola joins us now. You talked to docs about this, about what women should do now. Does this research mean stop, or what does it mean?
Exactly. You know, the research was released about 2 weeks ago and got a lot of women thinking, what do I do now? This is what I've always been told to do for a pain or a fever during pregnancy. So we did want to take a closer look. The CDC says about 65% of pregnant women use acetaminophen. The research shows using acetaminophen for 29 days or more during pregnancy doubled the expected risk of ADHD. Information was gathered from more than 95,000 mothers and nearly 113,000 children born between 1999 and 2009. This isn't the first time an association has been made with acetaminophen and ADHD either. UCLA released a study back in 2014 saying taking the drug during pregnancy increased the risk of ADHD by 13 to 37%, and if taken more than 20 weeks in pregnancy, the risk increased 50%. Riley Hospital for Children Dr. William Cronenberger says the recurring studies prove some sort of relationship, but shouldn't affect clinical decisions just yet.
Now, why that association occurs is the big question. It does not necessarily mean that the acetaminophen caused the ADHD. It could very well be that there's some other factor at work here that is related to both acetaminophen use and ADHD.
Some groups are speaking out against the research, including the American College of Obstetricians and Gynecologists and the nonprofit Children and Adults with ADHD. They say the results don't make biological sense. The only known predictor of ADHD at this point is genetics, so if mom, dad, or another biological relative has ADHD, the child is more likely to as well. There is also research indicating smoking or drinking alcohol during pregnancy can increase the risk of ADHD.
As with most studies, we see groups come out, doctors come out at different points saying, okay, I don't buy the results of this study. For people who are saying that, what is it that they would like to see done in the future studies?
So the groups I mentioned before and the doctor we heard from Riley Hospital for Children both questioned the methods used. So they used questionnaires to ask the pregnant women about how much they were using Tylenol. I can't remember people's names when I'm pregnant. And so they question how well we really remember how much we're taking or how little we're taking. And then they went back and used coding from medical records to see which children were diagnosed with ADHD. There are several different codes used. Doctors diagnose in different ways. So they feel that both of those things should be independently verified, not just done with questionnaires and codes.
All right. Well, it's interesting nonetheless. Thanks for diving into that. We appreciate it.
Yep.